Morning, good afternoon, good evening, everyone, from wherever you're joining us. My name is Lawrence Clausen. I'm the Senior Associate for CAM and Comms at the Data.FI project. And we have a really exciting webinar for you all today with some really great speakers. I just as a quick housekeeping note at the beginning, we'll have plenty of time for Q&A at the end, and we think this will generate a really excellent discussion. So you hope you stick around for that. If you do have any questions throughout the presentation, though, please feel free to write them in the chat, and our presenters who may not be speaking will try to answer them. So if at any point something comes up or you have a question, just again, feel free to put it into the chat, and we'll have the Q&A session at the end as well. And just a reminder that this webinar is being recorded and transcribed. So Anu, next slide, please. Just to briefly introduce our excellent panelists, our excellent speakers. Anubhuti Mishra is the Senior Technical Advisor for Data Science at the Data.FI project, and we're really lucky to have her both speak on her own and partly moderate the discussion. Bahar Chada is the Partnerships Lead for International Development at Premise, the partner organization company we worked with for this study. And Asatu Zongo is our COVID-19 data analyst in Burkina Faso, joining us a little later in the afternoon and the evening. So we're really grateful to have her. And she also works for the Data.FI project. So with that being said, over to you, Anu.
Thanks a lot, Lawrence. Thank you for getting us all together and scheduling this webinar. And thank you all for joining. So over the next 45 minutes or so, we'll be talking about some of the COVID-19 related work we've done over the past year and a half as part of Data.FI. Data.FI is a USA project that's dedicated to bringing together data for decision makers to strengthen healthcare systems and healthcare outcome for people across the sub-Saharan Africa, Latin America. We are a consortium of, we work with a bunch of partners and across digital health systems, analytics, data governance, and decision support systems. And since COVID, we've also expanded our work beyond HIV space to COVID-19. So this work talks about COVID-19 vaccination programs. Late in 2021 and early 2022, some of the countries and USAID missions came to us saying that the vaccination rates in their countries was plateauing. A lot of countries were struggling. There was an initial increase in vaccination rates, but then it had plateaued around 50 or 60% amongst their adult population, and governments were struggling to get people to go out and get the vaccines. There were several reasons. People were either fatigued or no longer took COVID seriously. So to understand the cause for people not getting vaccinated, we rolled out these two different types of studies to understand people's attitude towards COVID-19 vaccines and misinformation that may be spreading in these specific countries, or people's beliefs about COVID-19 vaccines. And we took two approaches. One was to roll out rapid smartphone surveys, and a second one was to conduct social listening. So we'll talk about these two projects one by one. First, we'll talk about the smartphone surveys that we conducted across 4 countries: Cote d'Ivoire, DRC, Ghana, and South Africa. They were designed to understand people's attitudes towards COVID-19 vaccines, their history of vaccination. Had they received 1 or 2 doses already? Were there specific rumors or misinformation they believed about COVID-19 vaccines? In South Africa specifically, we were interested in understanding people's attitude or towards getting their children vaccinated. And we used a very new approach to collect this data. We worked with Premise to roll out these surveys on Premise, a smartphone based app, between April 2022 and August 2023. So before we look at the results from these surveys, I'll hand over to my colleague Bihar to talk about Premise briefly, so that he can give you an overview of how this app works. Over to you, Bihar.
Fantastic. Anu, can you hear me?
Yes.
Awesome. Thank you. It's very good to be here. Hello, everyone. My name is Bahar. I lead partnerships here at Premise. It's great to be in this webinar and discuss or talk a bit about who we are, what we do, and how we've been supporting Data.FI, but all sorts of other organizations across the international development space. So very quickly, Premise is a crowdsourcing platform for remote real-time data collection and analytics. We've built a global network of data contributors and a suite of technologies to enable primary data collection on the field with ease. We've been doing this for years, and we've been disrupting and frankly democratizing data collection and making it easier for development organizations to go from questions and insights across the globe. But before I go on with Premise, I'd like to kind of introduce a few problems or challenges that we've seen with primary data collection across different verticals in the international development space, from health to governance to monitoring evaluation, democracy and governance, and economic growth. Next slide, please. So when it comes to context monitoring, understanding the context where we are operating, the lay of the land, what communities or people may perceive or may think about a given topic, right? We tend to see across our partners kind of an over-dependence on anecdotal evidence for generating data and insights. And this has been across the board, across low and middle income countries, and especially non-permissive and complex settings. When we try to understand the context, at a time of crisis, when there may be a conflict or there may be a coup, or when we're dealing with the spread of an infectious disease, we tend to turn to experts or key individuals or key networks to understand what's happening in the country. We try to piece together different information and get an understanding of what's happening locally, right? While expertise on the ground is important, understanding the problems and needs at scale can really be challenging. Another problem that we've been facing and we see across the board is really the context frequently changes faster than the data can be collected. If we are dealing with a challenge all the time, as I said, conflict or a drought or a cyclone that may hit the place, or even if we are just thinking and trying to understand what communities across the board may feel or think about an issue, right? What we have to do is we have to send enumerators on the ground. We have to run large scale surveys, and the ability to do that at scale, at ease, and with speed really is limited. And what we tend to see is by the time we're collecting the data or we get the data and we're able to process it, the context changes. And we see this, and what you see in this slide is, I guess, it's a picture of Ukraine and how conflict kind of shifts from day to day. It's very dynamic. Next slide, please. No, can you go back? Sorry. Another one. Yeah. So yeah, whether an organization seeks to understand how flood may have affected a location or the wider populations at a granular level, or whether people have access to basic foods or nutrition needs, or if an organization trying to map out a route for possible aid distribution, or how people may perceive a sudden change, be it conflict, be it in terms of institutions or in terms of an event, right? It doesn't matter. Data collection at scale across populations, demographics, and geographies is cumbersome. And I think many of you can relate to that. Even though we have transitioned from pen and paper to tablet and smartphone, this has not brought about the step change we had hoped for primary data collection. We still have to build teams of people, train them, send them to the field to visit households. In some places where it's non-permissive, it even becomes an unattainable process, right? And then once the data is collected, right, we're spending a lot of time processing it, cleaning it, transforming it, trying to put it into different tools for understanding, for analyzing and visualizing, right? And this is still, no matter these changes that have happened, it's still slow, it's still painful, and frankly speaking, it doesn't scale. Next slide. So after painting that bleak picture and talking about some of the problems that we as Premise is starting looking at, right? And there's good news, right? And we think that there are a couple of really important changes in the overall tech ecosystems that are making it possible to totally flip this paradigm, right? And how data collection is done. So the first one is, as you can see, across low and middle income countries, the average cost of a smartphone has been driven way down in the past years, right? And this is particularly due to the availability of used and secondhand phones in those countries. We at Premise ran a survey with all our data contributors and found that the average cost of a smartphone that was used was about $31 and about $55 to $60 for a brand new one. Now, of course, this is not across the board for countries and even rural areas, but we see this really getting technology becoming more available and cheaper, and they're more affordable. Second, smartphone adoption rate in low and middle income countries has largely tracked has tracked this decrease in the cost, right? The Trade Association of Telecommunication Companies, called GSMA, they found that across all their members in 2020, about 67% of their residents in the middle and income countries own a smartphone. And they've modeled this to show that by 2025, we expect that the adoption rate of smartphones will be about 78%. Now, so we're seeing the smartphone ownership, right? And in the meantime, there is this, growth and availability and opportunity for people to make money in the gig economy, right? Either part or full income for themselves or the households. And looking at these, right, how there's right now, GIZ did this surveys and determined that there's about 40 million people that are actually making side money, doing side gigs, micro tasks of the sorts in the gig economy. So this is where kind of combining these two, right, the low cost or the more affordable cost of smartphones, the increase in the adoption rate of smartphones, and the gig economy, right? We see a real opportunity here because people that own phones can now get some sort of gainful employment through their phone, right? And so now we think it's possible to turn ordinary citizens who are living in areas where organizations need data into a solution of these problems. And, we have taken those challenges, and that's when we build Premise, right? So now, Premise is that crowdsourcing platform that turns into these citizens, local residents in different places. and this way we make it possible to collect data from them in places where organizations need data, or the types of people from whom we need data, the demographics, right? Women, if we want to sub-target just women, or young people, or the elders, etc. And we do it in such a way that it doesn't compromise on the standards of either market research or the academic research communities. And we've built this ability to get granular data in near real time from more or less anywhere. And we have the ability to reach, to reach globally through a universal subscription. And we can talk about that later. Next slide, please. Because we're able to tap into this opportunity of leveraging the crowd, right? Local residents living in different places, right? We can make primary data field collection significantly faster than ever before, right? Almost everything through Premise is done between 1 to 30 days. We make it so much easier because organizations now don't need to hire multiple providers and across the country and across multiple countries, right? Organizations don't need to manage enumerators and their results and do this whole process that's required. And we just combine all these into one product, and most critically, we're already available at almost everywhere. Next slide, please. So how do we do it? Well, everything starts with our contributors. People like me and you living in a place that own a smartphone, that have access to internet either persistently or once in a while, and who want to make money on the side. Next slide, please. And these individuals get paid for sharing their opinions and observations. Opinions could be, responding to 4 to 5 minute, 25 question questionnaires that we can launch, and making 20 cents, 30 cents, 50 cents to $1. Or observations where they take that phone and they serve as enumerators themselves. They're able to go take a picture, perform a site visit, interview someone else, and they can make $4, $5, up to $15, depending on the country and the thresholds that we have for these places. Next slide, please. And we have about 6.5 million or so individuals across the world that have downloaded our app and that have served as data contributors over the years. This is in about 144 countries and 40 languages that are supported by the iOS and the Android system. Next slide, please. And we do this all in one platform, from instrument creation to quality assurance, deploying into marketplace, getting the information, sending it through QA types of algorithms, and getting it get the data authenticated, all the way to transformations and insights into either basic charts or bespoke dashboards. Next, please. So how does that work with Premise? Well, first, we build a task. This is the instrument. This is the survey. Some of you may use Cote Toolbox, CompCare, or other platforms. We have our own version. That's built within Premise. Once the questionnaire is built, then we deploy it into the marketplace. Next slide, please. And when we deploy in the marketplace, we have that ability because we know our contributors, we know their demographics, and in the next slides, I'll show kind of how a demographic overview of a network in a given country looks like. We have the ability to target or to deploy that survey to the right people, right places, and the right time. We can focus in just one geographic area within a country, one demographic, or a combination of two. Next slide, please. Once the data basically is deployed and individuals are submitting information, that goes through a set of quality control, machine learning, AI algorithms, and also what we call a human in the loop process. We're able to get individuals or to get data, basically detected through a lot. We collect a lot of metadata on every single user that is collecting or that agrees to collect the data. So we have the ability to understand their behavior, to see things like, are they spending enough time answering a question? We have contradictory logic types of algorithms in there, so we can detect potential anomalies in the behavior of the user, or do more like computer visioning. Are they screenshotting an image that they're providing? Is that a duplicate? Is that blurry, etc.? And the quality assurance algorithms, they're able to reject any data submission that has, any potential fraudulent behavior in it. Next slide, please. And I promise that I'll go quickly in these next slides. I know I'm wondering how much time I have left for my presentation, but basically, yeah.
Yeah, if you can wrap up as quickly as possible.
Yeah. So basically, yeah, with Premise, we have these two pieces of technology. One is the marketplace. That's where we're managing all the individuals. That's the app where they go and transparently see the pricing, how much money they will make, where they need to go to perform that data collection. Is observational data. And then once we launch it, the data comes into the platform, and the platform is the other piece of technology. A suite of tools. So that's where you're able to get your data into insights, dashboards, or even be able to build your own one-page maps or multiple presentation type of tools in there. So next slide, and then maybe I can wrap this up. Now, what I've presented so far is really our ability to get data from any country, kind of the ability to be able to do it quickly, but for generic data, right, for sentiments or observations. But what we've seen across the board in the past 10 or so years that we've been working with development organizations is really that most of the work fits within 4 types of solutions: context monitoring, social and behavior change, market studies, and mapping. And each of these solutions has its own processes and its own capabilities. So context monitoring, think of this as understanding the lay of the land, running longitudinal surveys that are done over time and then enable measuring and detecting changes in public sentiments over time. Or ad hoc type of surveys where you can kind of dig deeper into a specific topic. The other one is social and behavior change. This is more like a set of processes that we build within our platform to be able to to segment the audience, to be able to perform A/B testing of messages and understand campaign resonance, right? And measuring the performance of the campaign afterwards. Or mapping. This is points of interest enrichment, location discovery, site visits, route planning, so you can send people to perform these observations. If you're trying to, to understand wells in a given country, etc. This is where, and market studies, this is really very, for us in the commercial world, we do a lot of product pricing and availability, but in the development space, we see a lot of work around, needs assessments or understanding the price of fertilizer and how that can impact the agricultural yield of the farmers, or medications in a set of pharmacies during times of crisis, and how the pricing of medications or availability may impact different communities. So I'll stop here maybe and leave the other slides for the Q&A, where I can go kind of deeper and provide a demographic overview of, for example, what Anu is showing already here, of how a specific network looks like in a given time. Over to you.
Thanks a lot, Bayar. That was very useful introduction to Premise. We have certainly enjoyed working with Premise. There are, obviously, it's a smartphone-based app, so the reach is increasing, but there are limitations to its reach, just given the mode of deployment. But we found that it's really useful for rapid data collection, for especially for problems like we have mentioned that are rapidly changing, such as COVID-19 COVID-19 vaccination landscape, beliefs, rumors, etc. Over the next few slides, I will quickly show you some of the results that we were able to get across a few countries before we jump into our social listening work. So this is some of the result from South Africa, where the survey was focused on understanding people's willingness to vaccinate their children or their ward. So you can see here that although there was a considerable number of people who were willing to get their children vaccinated, big chunk, almost half, were unwilling, and that points towards a significant problem for the Ministry of Health in South Africa that can be addressed by understanding reasons behind or why people are not willing to vaccinate. Then one of the questions we also asked our responders in South Africa was around their attitudes. Why were they not willing to vaccinate their children? Did they think it was important or safe, or was it an access issue? Did they think it was easy to vaccinate, to get their children vaccinated? So you can see the response here that most people thought that it was easy, important, and safe, and yet they were unwilling to get their children vaccinated. Then in DRC, we looked at willingness to get vaccinated by gender. So we saw much higher rates of unwillingness to get vaccinated amongst women. Then again, you can also see some maps here. You can easily generate maps from the Premise platform. And here you can see a distribution of people, fully vaccinated population across South Africa and Ghana. Some of the gray regions are gray. Some of the regions are grayed out because we did not have enough sample size in these regions to calculate the vaccination rate. So they've been left out. But you can see in South Africa, we were able to get data from most regions. Just a reference before we jump into social listening, most of these surveys, I think a big part, the most time-consuming part was going through IRB in US and in country. That's I think that took a chunk of our time, but once IRB was approved, we were able to roll out the survey and collect the data in sometimes just 3 weeks. We in fact we stopped collecting data in almost all countries by week 4 because we had reached our required data limit. So that's how fast you can roll out and collect the data on these types of issues. Next, we will talk about social listening. So social listening, as the name suggests, is about listening to what people are saying about a topic or of interest across the internet. So this could be social media platforms, online blogs, forums, news media outlets, to understand where the conversation is heading. Are people, is the general perception online about a particular topic positive or negative, or are people disengaged and disinterested? And this can really help governments. When it comes to COVID-19, it can really help governments identify rumors, misinformation, and address them before they get out of hand, before they start spreading much more widely. So something similar happened in Burkina Faso. The Ministry of Health and Public Hygiene has a COVID-19 communication monitoring unit where they were collecting misinformation and rumors about COVID-19 in person at community healthcare centers, but they were interested in monitoring online conversation. As all of us know, internet can be a swamp of all kinds of rumors. So being able to proactively identify such misinformation and using that to guide their risk communication strategy would really help them address these misinformation or rumor issues head on. So they collaborated with us, Data.FI, to create this social listening dashboard that tracks 44 media outlets, several social networks, online forums, blogs, and review platforms. And tracks conversation. We started with COVID-19 vaccine, but then the Ministry of Health was interested in just learning more about just general conversation around COVID-19. And then eventually they wanted to also track other diseases. So for the next few slides and a demonstration of the dashboard that we built for the Burkinabe Ministry of Health, I will hand over to my colleague Asetu, who almost built all of this work single-handedly. So Asetu, over to you. Asetu, you're on mute.
Okay.
Yeah.
Can you hear me now?
Yeah.
Okay, thank you so much. My name is Onwa Seto. I come from Burkina Faso, and I'm so happy to present our social listening dashboard on COVID-19. And Data.FI Burkina Faso developed an Airshiny dashboard to combine multiple sources of data on COVID-19. And our first source that we use to collect a data is the UseCam. And UseCam is a platform for collecting specific information on social network on website. And we configure it to collect the data on COVID-19 and other disease that we want to monitoring with the Ministry of Health. The second source that we use is the community data, and the Ministry of Health collect information on the village and the community. And we know in Burkina Faso, the majority of the population cannot read and write, and we collect this information to follow up and to try to deconstruct our rumor in our community. And the last source that we use is the media, and the monitoring teams of the Ministry of Health collect the information during the interactive broadcast, and this information is inserted in our dashboard and to try to deconstruct it. Next slide. In addition to COVID-19, we collected the information on malaria, on HIV, and cancer, and dengue fever, because in Burkina Faso now we have a dengue epidemic. And for this year, we collected 1,364 posts on COVID-19. And we can notice here, and 12% of the people that made this post as a negative feeling about COVID-19, and 30.6% of its population has a negative feeling about COVID-19. And Twitter is the social website or network that we collected the most information about COVID-19. And our dashboard, we made the update on our dashboard every 4 minutes. And we connected also our UseCam platform to Telegram and to permit the Minister of Health to have the information. Next slide. Why we connected Telegram to the UseCam platform, and just to permit the Minister of Health to have information at the real time. It's so important to have information and the rumors on COVID-19 at the real time, because it's so difficult to log in on our dashboard every day and every time to have information. And we think Data.FI thing is so important to connect UseCam, Telegram, and to permit of the Minister of Health to have information on the smartphone at the real time. Okay. After that, we will present our social listening dashboard. Okay.
Yeah, I'll stop sharing and you can share your screen.
Okay, thank you. Can you see my screen?
Yes.
Okay. Thank you. First, I notified we develop our dashboard on Shiny, and on our dashboard page we have a first page, and this first page gives the overview of the minutes of L, the monitoring unit of the minutes of L, and the objective and mission of this team, and what these teams made of the minutes of L. And we also have the type of data that we collected on our platform there. And the second page that we can have is the monitoring tools that the Minister of Health use to collect the information on the community, and the WhatsApp, because USCAN cannot collect the information on WhatsApp and video content. And then we can have we must insert the information that we collected on our community. And if you want to insert the information on this table, we must press on the green button there. Okay. When you press on the green button, you must insert the information like region, because it's so important to know where we have this information, and the region, district, and the type of data. And when we talk about type of data, we have the information on COVID-19 and meningitis and dengue and malaria and other disease that we can collect the reports and deconstruct in our community. And after that, we must insert other information can permit us to have all the information that we want to deconstruct our agreements. And after that, we must submit our agreements. And this table, we have three colors. And our first color is the red color that indicates our rumors is not yet deconstructed in our community. And we also have a yellow color, and this yellow color indicates the deconstruction of our rumors is in progress. And the red color that indicates our rumors is finally deconstructed in our community. And we also have the information like on the strategy that we use to deconstruct our rumors in our community. We have other buttons like edit button to do an update in our rumors that we collected, copy button, or delete button that we think our rumors is not so important to deconstruct in our community. And we have a summary of the data that we collected here. That give a total number of rumors that we collected, the number of rumors that be deconstructed in our community, and other information that we want to monitoring our information that we collected. And this page is the page of the USCAM, that is the page that we visualize the information that we collected on the USCAM there. And first we have the button here to select the type of disease that we want to visualize in our dashboard. And I selected COVID-19. And we must select again the period that we want to see to our viewers in our community. And we have a number of the posts that we collected on COVID-19, the number of people that see our this post on COVID-19, and the number of the authors that made the post on COVID-19. We also dispatching this information by region, because it's so important to know where we can go to make a sensitization for our community. And you can notice here the central level and the southwest is the region that made post on COVID-19. And we make also the graph and to show the evolution of the post that we made on COVID-19. And we can notice here Yesterday, we collected most information more than today on COVID-19. And we dispatching also this information by day on the social network and to know where we can go and which social media we can use to deconstruct our knowledge. And we can notice here, Twitter is the social media that people use to
Asetu, I think you broke off there.
Yeah, I think her internet connection might have been disrupted. She just froze.
Yeah.
We
I
are.
think she's back.
Oh, yeah.
Are you back, Asetu? Can you hear us?
Yeah.
Sorry, you froze for a second there. Please continue.
Okay, thank you. And after this overview of the rumors that we collected on the website and social network, we dispatching this information by feeling of the people, but it's so important to know what is the feeling of the population and what people think about COVID-19 after disease that we can have in our community. And we can notice here we have most people that have the negative feeling about COVID-19 more than people can have a positive feeling about COVID-19. And we have 18.4% of people have negative feeling about COVID-19 and 10.5% of people have a positive feeling about COVID-19. We also dispatching this information by social website and social network to know where we can go again to know which social media we can use to deconstruct the negative rumors in our community. And we can notice here Twitter, we have 29% of people have negative sentiment. Netafric.net have a 40 negative sentiment. And we also dispatching this feeling by the region and our country to know where we can go and to deconstruct the negative feeling of the COVID-19 on our community. And the last page that we can have is the use can page on which use can be configured a dashboard and to monitoring all the information that we collected, and we can have here all information that we collected for this period in 1 month, October and November, this date. And we have an evolution on all the information that we collected here. And we have a keyword that people use in our community to talk about COVID-19 or other disease that we can have. And we notice here, people talk about cancer, October, Burkina Faso, brain and fight. Just to notify, October is the month of fight against breast cancer. And we also dengue and Ministry of Health, fight and day and Ouagadougou, because we have an epidemic dengue on Burkina Faso and people talk about so much on dengue in our community. And we have an example of rumors that we collected, all the rumors that we collected here, and we can read here to have information and all things that we want on rumors that we collected. This is all about my presentation of the dashboard, and I hope you like it. And Anu, over to you.
Yeah, thank you so much, Asetu. That was a great presentation. With that, that concludes our presentation. Now we have time for questions.
Yes, feel free to just raise your hand or unmute your mic. Thank you everyone for listening in, and yeah, happy to take questions. Emeka, I see your hands raised. Feel free to unmute and ask away.
Yeah, hi Lawrence. Thank you, Lawrence. Thanks, Anu and Zongo for your presentation. It was quite insightful. So I think I dropped my question on the chat box, but I can just read it out quickly. So concerning the U-Scan dashboard, right? With the data that you collected, were you able to, how was the government of Burkina Faso able to respond to those negative comments, right? When they responded, did you keep track to see if this actually changed people's perspective on COVID-19 vaccination? Did they have any change? Is there any analysis speaking to that? Then I think in Anu's presentation concerning the variations in the variation in vaccination for South Africa and Ghana, right? I don't know from your analysis, was there a reason why there was a variation across these regions in Ghana and in South Africa? Can it be linked to technology, or can it be linked to any particular thing? I don't know if your analysis captures something around that. Then South Africa had vaccination less than 50%. I think that was 42% or so, which is below the WHO recommended fully vaccination for a country. I don't know how are we responding to that? Did we take any actions after noticing that? Just wanted to know how you handle that aspect. Thank you.
Thank you, Emeka. Those are all very good questions. I will start responding with your last question. So for South Africa, those were the vaccination rates for children, so not adults. And I think the vaccine was made available for children under from like 5 to 12 years of age, much later than adults. So then the vaccination rates were lower, much lower as compared to adult population. And that's something that they were struggling with, despite like school vaccination campaigns, etc. So hence they asked us to conduct this survey. To your questions about if with the survey we were able to make a change in people's perception or their attitudes, I would say that this is the information that we supplied to the various MOH and USAID missions, and the survey. I will share the more the expanded results deck. It covered why people are not getting vaccinated. We asked people if they received the first vaccine, and if they received a second one. If they did not, what were the reasons? We did find pretty constantly that a good chunk of population was willing to be persuaded, but they were had become complacent. They didn't take COVID that seriously anymore. Or the government just needed to engage in more reach out campaigns, communication campaigns to reach those people. But there were still, like, depending on which country, there were like 15 to 20% of the population that just was not pursuable. They were very strongly against taking the vaccine. So, we shared that information with the different MOH, which they used for their risk communications, but we did not go back out to do a second round of survey or collect more information from MOH to understand if these surveys were able to result in a change in attitude amongst people. To your questions about like variation across regions, that's a great question. I think it varied. There were a lot of reasons for variations. Again, we asked users about access and whether it's easy to get the vaccine and where they live. So a lot of questions are related to access or the age of the population that's in those regions. Yeah, the reasons vary across countries. I'll share the results deck with you about that.
And I think it goes, I also want to stress that if anyone listening, if any of you want to know more about something or we don't get around to your question today, I will provide email addresses for our speakers, and I'll be sending out a mail out that you can reach out if, as you said, you're interested in the full results or you had just a question that you think of after we sign off today. So I'll be sharing people's email addresses. I'm assuming our speakers are all right with that, of course. Yeah, great question, Emeka. Any other questions?
I see a couple of questions about social listening. There's one from Annabelle. Our
Yes, in the
users
Q&A. Yes, exactly.
are users posting comments on their social websites, aware of that they're being monitored. So yeah, that's a great question, and privacy protection is very important, especially to a project like Data.FI. These you can only track posts that are already public across these platforms. So if I log into Twitter and I'm able to see some public posts that from people that I don't directly follow, those are the those are the tweets that you can track. So it's completely public information that all of us have access to anyway. But even when we pull this data into our dashboard, we are not pulling any individual information. We are not pulling any usernames, email ID, or anything into our dashboard or our Telegram integration. We are only pulling the content of their tweet, the content of their messages or their posts, and then the sentiment around those. And then I see another question from Emeka about how did the government use this system to respond to rumors and
Yeah,
myths about.
That was the question that he voiced as well out loud. I just wanted actually to maybe, because this issue of privacy and security is obviously so huge. Is a study published? We can get to that in just a second. But I just wanted to really emphasize this point of privacy and security, and maybe Bahar, you could speak on what Premise does and on the smartphone surveys to make sure that people's private information is still being secured. And if you could talk a little bit about that, I'm sure our attendees would appreciate it.
Yes, thank you. The security and privacy, we take those very close to heart. We have terms of service, so anyone that downloads our app, their PIIs are protected. We do not share the data, even if we're collecting data for them, by them. From our end, we do this in various ways, right? One is ensuring that infrastructure-wise, where we are deployed, right? We are a Google server or Google Cloud house, so all our data are protected there. If Google is trusted as an entity that can, in terms of protection from malicious users, then that's where we sit. So, and Google has not been hacked for a long time, and neither did we, right? In terms of PIIs, as I said, right, we're bound by the terms of service to protect everyone's PII. Even though our customers own the data that they collect, no personally identifiable data are shared with the customers.
Excellent, thank you, Bahar. That's, I think, a really good point that bears emphasizing and repeating. Any other questions? Anu, do you maybe want to discuss the publication of the study?
Publication of which study?
I see Oscar asked, is the study the results that we came to public, and he'd like to read it.
Oh, they're not published publicly yet, but I think, yeah, we might release a report on it. But yeah, I don't think we've released the results publicly.
Yeah, this is the study just wrapped up a couple weeks ago, so I think we're still writing up the report, if I understand correctly.
And Asetu, if you want to talk at all about how the Burkinabe Ministry of Health is using the social listening dashboard and our work for risk communications.
You're muted,
Sorry.
Asetu. There, perfect.
Yeah, sorry. The Minister of Health use Telegram to collect every information that we want now on them, because the epidemic of dengue, we collecting those case of dengue in our country. And yesterday I discussed with the CFA, and we talk about our dashboard help them to collect more information on them. And this dashboard is not public. We need the user account to connect with our dashboard.
Excellent. Thank you, Asetu. And then lastly, we're just about out of time, but Anu, could you maybe just in 30 seconds or so, Annabelle raises the good points, sort of a point less than a question about if someone understands their comment is monitored, might that change user attitudes when posting comments in the first place? Could you maybe quickly address Annabelle's point, and then I think we'll wrap up.
I mean, these are comments that we are monitoring across the internet. So, I mean, at least like we know that we post anything in public that can be collected by a third-party service to analyze those comments and those posts. So I'm not sure how much that has an effect on what people post. Obviously, there are like online trolls and chatbots, and all of that is there. And use can automatically flags those accounts and throws that kind of faulty data out of the data it tracks. But I do not think that in general, like we're all posting all the time on the internet, very well knowing that anything publicly posted will be monitored. So it does not change our behavior most of the time.
No, that's I think a good response.
Yeah.
Anything else? Simply categorize as positive or negative. Well, I'll just say we're basically at time now. So if anyone else needs to hop off, I want to thank you again for participating today, for attending. We hope you found this conversation informative and interesting. And yeah, thank you again so much for your time, and hope you have a great rest of your day wherever you're joining us from. But the speakers will still be sticking around for a couple more minutes, or at least Anu and I will. So maybe if we still have like 5 minutes, Anu, Behar, Asetu, for anyone else who has any questions.
Okay.
Perfect. So I thought, yeah, Annabelle raises another point that we might respond to.
Yeah, the platform automatically categorizes comments as negative or positive, but it does not categorize them as disinformation or not. So that's determined by the Ministry of Health, and hence we send word clouds, and I think Asetu, you might want to mute yourself. Yeah. The information, we directly send the information that we track to their Telegram messaging group. Okay.
And
I don't see any other questions. Yeah.
I don't think there's any either. So I think we'll call it a day then. Thank you again, everyone, for joining us. I'll end the recording now. And thank you so much, Asetu, Anu, and Behar, for your excellent presentations and discussions. So yeah, hope you all have a wonderful rest of your day, and goodbye.
Thank you. Bye.